Hello again. With the recent data from the Ministry of the Interior showing a rise in arrests by the Narcotics Control Commission in relation to drug use and drug trafficking, the sector ministry has announced plans to establish specialized courts to ensure speedy prosecution. Speaking during a donation ceremony which saw the handing over of pickup trucks and motorbikes to the commission, the Interior Minister Muntaka Mohammed Mubarak described the establishment of the specialized courts as a necessity.
That the Narcotics Control Commission intensifies target narcotic enforcement patrols during the festive season from December 2025 through to January 2026, focusing on identified hotspots across the capital and other strategic locations. These special operations disrupted distribution networks at a critical period, enforced deterrence, and contributed directly to the positive enforcement outcomes during the being recorded at the start of 2026. Ladies and gentlemen, government recognizes the effective drug control does not end with arrest and seizure. Sustainable impact requires credible prosecution and timely justice. This is why we continue to support the effort to strengthen Narcotics Control Commission's prosecutorial mandate, deepen collaboration with the Attorney General's Department, and advance discussions towards the establishment of a specialized narcotics court to fast-track drug-related cases and enhance deterrence.
The Interior Minister further expressed concern over the growing use of tramadol in the country, noting that seizures of the drug have now surpassed all other narcotics.
In 2024 and 2025, arrests increased from 56 to 158 cases, representing a 182% rise, with enforcement outcomes strengthening consistently throughout 2025. During the same period, officers seized 840 kilograms of cannabis and 341 kilograms of cocaine, confirming Ghana's active role in detecting and disrupting international drug trafficking. At the same time, the drug market is evolving, with tramadol accounting for 23% of the seized MPS piles, whilst the remaining 77% reflect a growing range of other psychotropic substances.
Muntaka Mubarak is the Minister for the Interior. Now, delivering his acceptance speech, the Director General of the Narcotics Control Commission, Brigadier General Maxwell Mante, assured that the vehicles will be effectively utilized to ensure the Commission's operational efficiency and service delivery.
These vehicles will greatly enhance our operational capacity, improve response times, and enable our officers to reach high-risk communities when required. They will strengthen our surveillance, interdiction, and intelligence-led operations. Honorable Minister, we assure you that these vehicles will be responsibly deployed, properly maintained, and used strictly in furtherance of our mandate to combat illicit drug trafficking, reduce drug abuse, and protect the safety and well-being of our fellow citizens. To our officers and staff, I encourage you to see this gesture as a renewed call to duty and a reminder to uphold professionalism, integrity, and excellence. In closing, we once again express our sincere appreciation to you, Honorable Minister, and the government of the people of Ghana for this invaluable support to NACOC.
Let's talk health now, because the sector minister, Kwabena Minta Kando, has expressed concern about medical doctors not accepting postings to rural areas. Speaking during a working visit to the Oti region, he expressed worry that out of 25 medical doctors posted there, some have not reported. The Minister of Health, Kwabena Minta Kando, also dismissed claims that newly deployed medical officers are being punished by being posted to rural and underserved districts, insisting that the appointments are necessary to ensure fair access to health care across the country.
A member of parliament, a regional minister, whoever you are, we must all put our heads together to find the solution. What we have realized again is that we post health professionals here and nobody will come. In 2025, we have posted about 25 medical doctors, and my checks indicate that only 2 have reported. Unfortunately, since I took office as a minister responsible for the health sector, I have indicated that no health professional should see going to serve in rural areas as a punishment. For me, in my humble opinion, it's a call to duty. And so I have assured all the districts and the regions that we are not going to change anybody's posting. Unfortunately, we can't do anything about it. So we'll stand by. If you have been posted to OT, you will go to OT. That is where government has vacancy, and that's where you will go. But we should also do an introspection of why the people are not going, and to be able to facilitate their stay, to attract more people and facilitate their stay in the regions. And that is why we have met here today.
Health Minister Kando also urged the MMDCs in the region to provide decent accommodations for health workers and incentivize them.
Yesterday and today we decided as a ministry to work from OT region. And the reason is very simple. As part of our retreat to analyze 2025 and to do projections into 2026, we realized that most of the health outcomes from OT are very bad. And so it needed some urgent attention. So since yesterday, we've had a very warm reception, trying to find solutions to turn the things, the outcomes or the narrative around. As part of that, I have instructed for a committee to do a complete and a comprehensive audit of the whole health facilities in the region. And quite apart from that, we realize that health professionals do not accept postings into this part of the country. A typical example is the fact that in 2025, we posted about 25 medical doctors, and as I speak to you now, only 2 have reported. So we decided to come down, engage all stakeholders. The challenge is such that no one person can sit anywhere and prefer solutions to the challenges. And so since yesterday, we've been engaging the major stakeholders, the chiefs, the health professionals, the MPs, the DCEs, the regional minister, all stakeholders within the region to find solutions to these problems. We all know that health is very essential. And as part of the solutions, certain measures have been proposed. Fortunately enough, all stakeholders have agreed to stand by those measures that have been proposed, i.e. looking for befitting accommodations for health professionals, putting some vehicles at their disposal, some internally arranged allowances to motivate them to come into the region. And I have made a point from government's perspective, we are committed to doing our part. I don't see how we are going to change our position on the postings we have already done, because government can only declare vacancies and will need health professionals where they are needed most. It's quite instructive and disheartening to note that about 50% of all medical doctors we have in the country are all in Greater Accra region. If you put Greater Accra together with Ashanti region, we are looking at about 65 to 70% of all medical doctors in the country. And for me, that is not fair. The distribution is uneven, and we must do everything it takes for everybody in this country to feel part of the country and to enjoy the benefits we have in the country.
Let's go into the telephone lines right now and speak to the OT Regional Director of Health, Kofi Amo-Kwadia. Thank you very much for your time this afternoon. The minister has indicated that out of the about 25 persons that have been posted there, a few of the medical officers have actually reported to work. How many are yet to report?
Well, out of the 23 that were posted here, okay, young man, thank you very much for this question and interview. And I must say I'm grateful that we have been brought to the air for everybody to know what is happening in OT so far as health services are concerned. Well, to answer your question, actually 23 doctors were posted to OT. And out of that, only 2 have so far reported. I personally took a phone and called all of them one by one, trying to entice them, encourage them, and give them the moral support to come to OT and work for us. But as we speak now, only 2 have reported.
The minister also urged health facilities in the region to incentivize these medical officers who are posted to these regions and, of course, provide them with accommodation as well. Are these some of the challenges why the medical officers are refusing to be posted to the area?
Actually, the minister urged the community, I mean the MCs, and then DCs, MPs, and all stakeholders to come together to incentivize, health workers, not the health facilities. You know, the health facilities are already overburdened with a lot of challenges. So how are they going to get the money to incentivize them? But then the minister actually met all of us and urged all of us as stakeholders to come together to think of a way of incentivizing and attracting the health workers.
And how is their unwillingness to come to their posted region affecting healthcare delivery in the OT region?
Well, it is adversely affecting service delivery in the region because we've had some of our facilities being downgraded because of lack of personnel to man them. You see, and services that are actually rented at a normal hospital will not obviously be rented in the absence of the doctor. You see, so it has basically affected the general of health service there.
You mentioned earlier that only 3 of the 23 individuals
only 2, sir.
Only two of the 23 medical officers who were posted to the area have reported. Now that you've made calls and they are refusing to come despite the calls that you've made, what are you going to do about this?
Well, we will continue calling them, and now I think the problem is not in our court anymore, but rather the Minister of Health and then all other stakeholders. The challenge is in our court, not on the court of the Health Directorate alone, because we will always continue to do our best to entice them to come. But we can't really also go and pack their things from their homes and virtually bring them here. So they should also go a little way to really understand that, yes, we are all in a country and our people have all contributed one way or the other to their schooling, so they should understand to give back to those of us who find ourselves in challenging situations.
When you called the other 21 medical officers who have refused to turn up, what reasons did they give you?
Well, some completely said they will not come. Reasons being that they have their children somewhere, some have just gotten married, and some, I have another option. So, normally when you post them to this place, what they look they do is that they stay away and then maneuver their ways to get into places like Greater Accra and Ashanti region, where they can find locum to do whilst working with the government institution. For instance, in OT here, if you come to work as a doctor, you may not find any locum to do to support your salary. And we all know how the salaries are, but then there is nothing anybody can do about it because we are serving our country. You see, so we have to give in a little to serve the country.
Right.
So, I mean, that is the situation.
Right. There has been sporadic conflicts in Kwanta, in the OT region, in recent times. Is that one of the reasons they give for their unwillingness to come to their posted region?
Well, that is partly a reason, but I will put it down on the conflict in Kwanta because before the conflict even erupted, and I mean, people were refusing to have get posting. Accept postings to this place, and even I mean, the conflict is only at one place in Kwanta, one district out of the 9 districts.
Right.
So why are they using that as a reason for not accepting posting to the other, assuming that is their reason?
Right.
Why wouldn't they then accept posting to the other 8 districts?
Okay. Kofi Amon-Kodia, thank you very much. This is the OT Regional Health Director. And that's it for The Pulse this evening. We came to you live from our studios here at Kokomlemle. Thank you very much. The news team returns at 7 p.m. with JoyNews Prime. My name is Kenneth Jesse. Have a good evening.